Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith-Rogers. Today, a new report on attacks on healthcare and healthcare workers around the world. This month, the Safeguarding Health in Conflict Coalition released its annual report documenting more than 2,500 such attacks. Professor Joe Amon is the director of the Center for Public Health and Human Rights at the Johns Hopkins Bloomberg School of Public Health. He joins Dr. Josh Sharfstein to discuss the report and three key trends: the role of state actors, the use of drones, and the consequences of cuts to USAID programs. Let's listen.
Professor Joe Amon, thank you so much for joining me today on Public Health on Call. How are you?
Good. It's my pleasure to be here.
So we're going to talk about this report from the Safeguarding Health in Conflict Coalition. What is that coalition?
So the coalition started a little over 10 years ago. Professor Len Rubenstein from Hopkins was involved in the start. He and I collaborated on the first report, and it was really recognizing that protections against health workers and hospitals was being violated in conflict settings. But there wasn't a good process of collecting data about this. There wasn't a lot of understanding of how often it was happening. There were some high-profile events that occurred, including an attack on Doctors Without Borders clinic in Afghanistan. But we wanted a more systematic and rigorous approach to looking at how big the problem was. And so we started the coalition with that purpose.
And the coalition issues reports with some regularity talking about how many attacks there have been on healthcare.
That's right. We collect data with our partner Insecurity Insight all year round through a variety of different sources, including direct reporting of attacks, looking at media accounts of attacks. And then we put out an annual report each year that summarizes how many attacks have occurred, what types of attacks, and where.
So we're going to talk about the 2025 report, which is just coming out now. But before we do this, I want to ask a question. It may seem obvious, but I want to hear how you would answer it. Why focus on attacks on healthcare? There are attacks on all kinds of civilian infrastructure and individuals. Why healthcare?
You know, it's good that you asked that question because one of the models of our approach at the very beginning was the coalition that had been formed to protect education in conflict because schools were also being targeted. And we kind of thought, well, schools are incredibly important, but so are hospitals. And one of the things about attacking hospitals or clinics, ambulances, is it takes a long time to reestablish the facility, to find and train new health workers who've been killed in attacks, to buy ambulances and put them into practice and protect the people who run the ambulances. And so that's really, I think, something very critically important. And I'm not trying to make it a competition with schools.
Yeah.
But it's critically important that it be understood.
And there are also global standards, international law that pertain to healthcare.
Absolutely. International humanitarian law is very specific that civilian infrastructure and that hospitals in particular should not be subject to attack. There are some specific situations where if a hospital is completely taken over for military purposes, it may become an object of attack. But it still has to be protected if it's not really a strategic object. Just destroy the hospital because you think there are some soldiers in there. If there's soldiers in there that are getting medical treatment, that's not justification for it. And the consequence of attacking a hospital and destroying it, even if it's temporarily occupied by military forces, doesn't necessarily meet criteria that have been established in international humanitarian law related to proportionality.
So let's talk about the results from the 2025 report. What was that year like?
So, one of the things that I have trouble with sometimes when talking about results is that I can spew out a whole bunch of numbers. In 2025, there were 2,546 recorded incidents across 33 countries. 790 health facilities were damaged or destroyed. 455 health workers were killed. 218 were kidnapped. 263 were arrested. But to me, those are numbers that we have information on, we can count, they're likely underestimates, but they don't also speak to the millions of people who depended upon that health center, that depended upon those health workers, and the consequences that they face not having a place to go to continue to get treatment for chronic diseases, to get maternal and child health care and everything that, we all need in terms of staying healthy.
One facility can serve thousands, tens of thousands, or even hundreds of thousands of people.
And that's something that we've been really trying to address better. In some places, a hospital might be targeted, but there's another hospital within 10 miles. Right now, we're doing work in Sudan, and it may be 100 miles, maybe 500 miles to the next facility that's open, that's working. And that's just not feasible for people to access.
So the report has 3 main findings. I'd like to ask you about each of them in turn. Is that okay?
Sure.
So the first key finding is the rise in attacks on healthcare by state forces in foreign countries. Tell me what you mean by that.
So it's basically the idea is, and these are findings, these are sort of new trends that we're identifying. And basically the idea is that these used to be more often attacks that were done by rebel groups. They were attacks done by, people who were trying to steal equipment out of hospitals. But since 2021, what we've really been seeing is that military, state government militaries are responsible for the majority of violence against healthcare. And that's a change. And that all parties to conflict are subject to international humanitarian law, but there's a higher expectation for organized militaries to understand and to abide by the rules of warfare, and they're not. And that's a big factor. What we found in 2025 was that state forces were responsible for 2/3 of the incident versus the minority being non-state armed groups.
And can I ask which states were overrepresented in that group?
So the states include Russia, for example, like with attacks on Ukraine. In Myanmar, you have Israel. In Gaza, you also have state forces in Sudan. And so they're really the largest conflicts in each of those cases.
Let's turn to the second finding, which is the expansion and rise in drone warfare, increasingly affecting healthcare. Tell me what's going on.
Well, we've seen this for a number of years, but in 2025, compared to the year before, there was a 40% increase in the number of attacks that were attributed to armed drones. So there were 286 attacks in 2024 and more than 400 in 2025. And they are able to, they may be loaded with missiles, they may be loaded with armed weapons, and they can target health facilities, destroy health facilities, kill and injure health workers. A lot of the attacks that we identified, roughly 70%, were coming from Russia. And Ukraine has also used drones in warfare. Sudan had a 700% increase in drone warfare attacks. And that was coming from a much smaller number in 2024 than in the other countries.
What are the implications of the rise in drone attacks on healthcare?
I think one of the things that we've seen, drones are relatively cheap. They're precision targeted. So it's difficult to claim that it was an accidental attack or that it missed a target and accidentally hit a health facility. But I think another aspect of it is that you have kind of clear allegations that, these are war crimes, that these are facilities that are being targeted by drones. There's an understanding of what the drone is hitting. It's hitting it in a precision way.
Do you think that has implications for accountability?
Absolutely. It should. The problem that we've seen to date is that there hasn't been a lot of accountability. And one of the ways in which there's accountability is counting numbers, right? If you report on things, if you identify things, if you attribute it convincingly, you should be able to follow through. There's naming and shaming, which is often done in human rights research. And that could come at the highest level. The UN Security Council could be putting out their own reports on this. The Secretary General could be specifically naming the worst actors on this, but it could also come in international courts. And because this is a violation of international humanitarian law, parties that violate the legal basis for IHL could be held to account and could be jailed.
Yeah. It suggests that if there were, in fact, deliberate instructions to a drone to attack a healthcare facility, that those instructions could actually someday find their way into court.
Absolutely. And what you see is that, people are visualizing the strike up until the moment in which the drone is releasing a missile. So it's hard to say that, there was a mistake. And one of the other things that you see are multi-tap strikes. You may have heard of double taps where there's one strike and then first responders come and then there's another strike. But what we're seeing is it's more than just two strikes. One strike hits a hospital, first responders come, civilians come to help, and then there's a second strike, and then there's a third strike, and then there's a fourth strike.
Let me ask you about the third key finding, which is the impact of global USAID funding cuts and how they have impacted this area of attacks on healthcare.
Yeah, I want to emphasize that this is not just international humanitarian law that's being violated, but it also is about the right to health. And if you are destroying healthcare facilities, if you're killing health workers, you're putting in place obstacles to people realizing the right to health. And so, what we really have understood also is that a lot of reproductive health facilities have been targeted in Afghanistan and the Democratic Republic of Congo and Myanmar, in Palestine and Sudan, Ukraine, and many other countries. And that's just fundamentally making it even more difficult for countries that have already lost international development assistance to maintain safe motherhood and to ensure that people are able to access all kinds of medicines. Supply chains are also being targeted and cut off. And that's another way in which the pullback from USAID is complicated by this overall trend in attacks.
Is part of the issue that if there's a hospital that's damaged without the resources that USAID provided, it's just harder to get the services stood back up?
That's absolutely right. And what happens is, people, instead of going to a health facility to give birth, they give birth at home. And we know that is more dangerous than having an attended birth.
So where does this leave us, Professor Amon, here in the middle of 2026, looking back on 2025 and peeking over the horizon? What do you think?
Well, I think the point that you raised about accountability is incredibly important. And I think that accountability has to come in response to holding the line and making sure that people actually do respect international humanitarian law. And that can be done at the highest level in the UN Security Council. There can also be a stronger effort made to regulate drone warfare. Governments can commit to, protecting health workers and not attacking health workers if they're doing it in their own country. If it's possible to restore and sustain humanitarian funding from USAID and other donors to rebuild, that would be incredibly important. But I think that, what we've seen over and over again is that just doing the monitoring that we're doing, just putting out the reports that we're doing, makes an impact and makes people aware of the importance of the issue, but it hasn't changed anything. And fundamentally, attacks on hospitals and healthcare are not accidental, but they're purposeful decisions that are being made in violation of international law.
Well, I hope we see the tide turning on this terrible problem. I really appreciate your coming to talk to us. Thanks for appearing on Public Health on Call.
I'm glad to be here. It's an important issue, and I hope everyone can take a look at it. And hopefully the conversation we have next year is better than the one this year.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.